Well, joining me now for deeper insight into Kenya's worsening COVID-19 situation is Dr. Willis Akhwale, the chair of the Vaccine Task Force. Thanks so much for joining us on this important day. The positivity rate is at an all-time high of 18%. We're seeing more and more people infected each day. Dr. Akhwale, how worried are you with where we are as a country in our fight against COVID-19?
Thank you for this. Let me start by saying, looking at the positivity rate, looking at the hospitalization rate, the trend seems to be worrying. But as was stated today by the Cabinet Secretary, Akhwale, we are still in the third wave because we never truly controlled the third wave. We never went to a 5% positivity rate for a period of 2 weeks. And definitely what we are seeing is a surge. Now, this disease, this global pandemic is unpredictable. It seems to defy a lot of what we epidemiologically know. The epidemiological curve where you can predict when now things are getting under control. And that is why the issue of dropping the guard, as was stated in today's statement, is important. Lessons we learned from the 1918-1919 pandemic of the Spanish flu, it is at that point that people dropped the guard that it hit hardest.
All right, so your message, therefore, is don't drop your guard because we are in a risky place. Now, CS Kagwe has mentioned that it is the Delta variant, which is extremely contagious and responsible for this fast spread of infections. Tell us more about this variant and how is it responding to vaccinations?
Yeah, thank you for that question. This virus, the coronavirus disease, there are various variants coming. They have now been named into the, is it Greek or alphabetical order, Alpha, Beta, Delta. The very first one was Alpha. The Delta variant is first reported in India. It is found to be more transmissible, meaning that if you are within a closed environment, and you compare where somebody who had an Alpha variant and you compare somebody with a Delta variant, the current studies show that it is maybe 60% more transmissible. You will infect more people than when if someone who has the Alpha variant. Therefore means more people will get sick. Whether they are asymptomatic or whether they will develop severe disease, but more people fall sick, and that is a strain on the health system, is a burden to the overall health sector. So that is one. Now, when it comes to the issue of vaccination against the Delta variant, the studies that have now been done are clearly indicating that the approved vaccine by WHO are slightly less effective. Let me point, they are not that they are not effective, they are slightly less effective. So there's unpublished data, but I am privy to that, that shows if, for example, one vaccine was 92%, on the Delta variant is 88%. So the vaccines are still effective, but slightly less effective against the Delta variant.
All right, and where are we with regards to our vaccination drive? What is the status of the vaccines in the country? Have we completely run out? Explain that further to us, because we have seen people trying to turn up for their second or even first vaccine, but being turned away because health centers don't have them.
Yes, thank you for that question. Of course, our first phase, which ran from March to June, the biggest challenge we got was a global constraint in the distribution and the availability of the vaccines. And there were very many reasons to this, including that the rich countries really overbooked the supply chain. They went to the manufacturers. So the low and middle income countries could not access this. We also have had situations in which the raw material was not readily available to the manufacturers. So that was one major constraint. So we had to adopt to that. And we as a country, so far we've received 1.73 million doses of the AstraZeneca vaccine, and by the records today, we are vaccinated very close to the 1.7. So in the country, As we speak, we have between 35 and 40,000 doses still unused. And of course, that means, therefore, we are now at that stage that we need to restock. The good news is, especially starting this weekend and going to the next few weeks, our situation is going to change. We are going to move from the season of scarcity into the season where we have adequate, and even projecting towards the end of the year where we may really have plenty of these vaccines.
So does that mean this weekend we will receive more vaccines?
Yes, you may have seen the statement from following the visit of His Excellency President Uhuru Kenyatta to the UK. The UK today has announced it's giving us about 807,000, over 800,000 doses of the AstraZeneca vaccine. These are going to be split into two. There's a direct donation of about 400,000 doses. We expect this. Tentatively, they are being booked to be here over this weekend. And another 400,000 will be supplied to us through the COVAX mechanism, and we'll be working to get those through. We also have about 235,000 doses of AstraZeneca coming from Greece. We also have some doses coming from Latvia. And as you know, the US government is going to give us about 1.8 million doses of Pfizer. We expect this in 2 to 3 weeks from now. And also, outside the donations and everything, the government of Kenya has procured 13 million doses. Through the African Union, they have assured us they are delivering this in August. The specific date is a subject of discussion this coming Tuesday.
Okay. Well, we look forward to hearing more on that. What is Kenya's policy on mixing of vaccines? Earlier, we heard Dr. Amoth say that in some cases, there may not be a problem with mixing. But can you clarify that?
Yeah, so let me say that studies have started coming out. Countries have started practicing. So two processes take. First, the World Health Organization usually gives guidance, and guidance means the countries may adopt, but they may also make their own decision. In this country, we have a body known as the Kenya National Immunization Technical Advisory Group that is chaired by Professor Ware of the University of Nairobi. They review data either from WHO or from studies, and then they appropriately advise the government. Let me say that public health policies are not made from 1 or 2 studies. If you do that, you are then not going to have very sound public health policies. You need to review a lot of studies. It needs to be interrogated. You need to understand, and you have to look at factors beyond just what the studies are showing. For example, in low and middle income countries, every vaccination has a cost. The more the vaccination, the number of times you have to vaccinate, that is a cost. So you ask yourself the acceptability of several vaccination episodes and the cost of doing that. So for us here in Kenya, I think we are going to subject to that. And yes, we could go and say this is working, but we may also interrogate and say, like we are now going, there will be increased vaccine. Okay. I think one thing I really need to tell Kenyans, because there are Kenyans already fully vaccinated with AstraZeneca, but I have heard in the corridors people saying, I'm waiting for Pfizer to also be vaccinated. That will deny Kenyans who are not vaccinated the chance to be vaccinated. We don't want to go that direction.
Right, okay. And the world is talking about a third booster dose. Are we expected to participate in that as well? Will Kenyans need to vaccinate one more time, a third time?
Now, let me also clarify that, a little bit of science, and talk about number of doses and a booster dose. Mm-hmm. Now, in the stage where we are, where a lot of these vaccines have been given emergency use listing by the World Health Organization and by a Pharmacy and Poisons Board, the first question we want to know is how many doses do you take until you have an optimal immune response to defend against the disease. Then you look at how long will it wane so that a booster dose brings you back to that. So you don't start talking about a booster dose before you are clear about how many doses you require. I believe the discussion about booster doses are a little bit premature, given that even the very first recipients of the COVID-19 vaccines have not had it over 1 year. In many other diseases, you will be protected, and then we assess that a booster dose will be required after this period of time. So I think a little bit of more science is required before decisions on booster doses are made.
Now, even when we did have enough vaccines, I should say, at the start of this rollout, we saw a lot of apathy, even among health workers and teachers and some of the elderly age group as well. What is the government doing to encourage people to be vaccinated? Because whilst we know that vaccines won't prevent you from getting COVID-19, it does prime your body to put up a better fight.
Yeah, so let me talk about apathy. I want to equate that to hesitancy and say that, you see, when vaccines are new in any country, you go through what you call an introduction. You have to put systems in place. You have to work with the regulators because certain information. And for us, given the quantities that we received, in the first almost 3 weeks, we were only vaccinating at 1 facility per county as we continued training. So the issue of apathy has 2 issues. There may be the issue of confidence, but there may be the issue of convenience. And convenience means the vaccine has been brought close to you. I walk a kilometer to be vaccinated. Now, the people we targeted, healthcare workers, security forces, and teachers, when you have only 1 or 2 facilities, that was not the most convenient. Right. But we've continued rolling that. So that should not be misconstrued to mean there was no confidence. Because if you look at the data, as we rolled out and included more facilities, you started getting more people turning up. However, we know that there may be still a group of people that are hesitant. There is misinformation. And now in our next phase that began this July, we are going to go to the communities. We are prepared to launch a communication campaign. We are going to give people the right information. We are going to empower. We are going to do outreaches. We are going to do community sensitization. We are going to work with county governments. We are going to use opinion leaders so that you have the right information to make that informed decision. Vaccines save. Vaccines are working.
Okay, and vaccinated or not, at the end of the day, people still need to be cautious because we don't know how long this Delta variant is going to be around for, and we don't know if we're going to get another variant that may be even worse. So as we close, what is your message to Kenyans, vaccinated or not, that aside?
Vaccinated or not, do not drop the card. Continue your basic physical distancing, continue good hygiene practices, respiratory practices, hand hygiene, continue ensuring that you are masking. You've seen even in the US where they had said drop masking, they are now saying even indoors you may need to mask. Let us not drop that. That's first and foremost. Secondly, medical history, and you look at even the Spanish flu, we don't know when it will, because viruses are very prone to mutation, unlike bacteria and parasites. So they may keep changing, and there may be those variants of concerns, and they may become virulent. The only protection, if even as we go to 3rd, 4th, 5th wave or different variants, get vaccinated, because vaccines protect you from severe disease, hospitalization, and death.
All right, Dr. Akhwale, thank you so much. I'm afraid that's all we have time for. There is always so much more to talk about, but no doubt we will be connecting with you later. Thanks very much for your time and shedding light on that issue on this day where the COVID-19 positivity rate has hit 18.0%. Joining me in studio was Dr. Willis Akhwale, the chair of the Vaccine Task Force. And that closing message, get vaccinated if you can. We're expecting getting vaccines in the country very soon. And also, wear your mask correctly, wash your hands, sanitize, and keep social distance. We can't remind you enough.